we really pride ourselves on taking care of kids across the age group here. And so one of the things we really strive for is getting all of our kids in for their well child checks in a timely fashion. And so what that means is, after they turn 3, we like to see them once a year. Before they turn 3, there's a lot more visits before then, depending on the age of your child. But the importance of keeping those on time, so for a multitude of reasons, but a lot of them involve development. And so making sure that we're seeing kids where they need to be seen to follow up on making sure they're meeting their milestones. And if they're not, the earlier we intervene, the better outcomes they have in childhood as far as long-term goals. And then for our adolescents, we really like to follow up on how things are going. We understand that adolescence can be a tough period in a lot of kids' lives. And so we follow up on things like how their mental health is doing. We follow up on making sure they're making good choices and intervening if we need to with the help of their parents to hopefully give them the best outcomes we can. And then in between there, between kind of that 3 and adolescent time frame, we like to see kids once a year for very similar reasons, but one of them especially is having to follow up on how school's going. And so we like to make sure that we're not having difficulties with learning, concentrating, making sure we're not having issues getting along with others, and that if we are, we're able to help them and give them the resources we need to help them be successful adults. And so in addition to development, school, things like that, we also like to make sure we're getting kids all their immunizations. So our goal is to have all kids receive their childhood immunizations by the time they turn 2, but then we also have yearly immunizations like our flu shots, our kids 5 and over, we're doing our COVID vaccines, all of those types of things. And so also making sure we're keeping kids on time with those. And a lot of times what people don't understand is if we get behind or we miss a well child check, those vaccines have to be spaced out in a specific time frame. And so we're not able to get some of those kids fully immunized by the time they turn 2 if we're delaying those well child checks. And so that's another important aspect that we like to focus on.
Being worth the care means putting yourself first and scheduling yourself in or putting yourself first on your list, because we all spend every day taking care of other people. We forget that we're worth care too, and who is better to provide it than us? So we should put ourselves proactively on the top of that list. When we delay that, sometimes we don't turn up until too late. For example, we'll see someone coming into the hospital who is about to lose their foot because they've had diabetes for 20 years untreated. That's dramatic, but true. When we wait too late, sometimes we have a cancer that's harder to treat. When we wait too late, sometimes we have not just our original problem, but complications of our original problem. So now we've got 2 things instead of 1, or 3 things instead of 1. Those are the kind of things that happen when we don't prioritize our own care.